Now, one of you tagged me into this video and he wanted me to share my insights about this. And this is a very well known PhD holder. And I went through his posts and I was so amused by the type of work that he's doing. But this video is intentionally designed to help people live with diabetes, not to help people reverse diabetes, but to help people live with diabetes, even though the gentleman has done deeper studies and even research on how to manage diabetes. The word is manage. So I want you to look at this video and then we analyze it. So be patient with it until the end so that when I make an analysis, you will understand where I am coming from.
Since I started this experiment to try to master the act of managing diabetes, one of the things that has become significantly clear is that alcohol is actually good for managing diabetes. Yes. You see, anytime you take alcohol, your blood sugar level drops so much that even if you take carbohydrate, it becomes very difficult for it to rise to that spike level. Number two, anytime that you take in alcohol, your liver stops working on the glucose and begin to work on the alcohol. And because of that, you don't spike. Number three, when you take alcohol, you have a good sleep. And anytime you have a good sleep, your fasting sugar is very fantastic, as you can see from the graph that I've shown there. However, when you don't have a good sleep, your fasting sugar is always bad. And now let's talk about the side effects of using alcohol to manage your diabetes. When you take alcohol, your blood sugar level goes so down that if you're not careful, you have what we call the low blood sugar level, hypoglycemia, and that can let you even pass out for some time. So if you're going to use alcohol, please be careful. You see, some of the alcohols I recommend for you would be number one, would be wine, red wine. Number two would probably, let's say, whiskey. But please, whiskey is bad. Too much whiskey is bad. So moderate drinking is the best option. Now, let's say you are a lover of alcohol and you've gone to a party, you don't want to take medication for everybody to see, or you have this your good meal and it's carbohydrate induced. You take a few shots of what do you call it, whiskey or red wine, and it works perfectly. But please, no beer, because beer actually spikes the blood sugar level. There are other alcoholic beverages that I can recommend for you, but I don't want to advertise for any company here. So you can come to my inbox and then we will sort that out. Now, if you're not alcoholic, please don't start simply because I'm saying that it's good at managing diabetes. No. But if you are my follower and you like alcohol, please you can try this experiment and come to the comment section and show your results. Once again, my name is Kwame Ofori, PhD. If you say a prayer, say one for me.
My name is Dr. Lewis, PhD. And if you say a prayer, say one for me. Now, it is so tiring that somebody can actually tell you that alcohol can be used to manage diabetes. In the first place, alcohol can be one of the causes of type 2 diabetes through the fatty liver. But I'll explain this. So, number one, the first thing that I noted in this video is he used his words selectively. He said that alcohol can be used to manage diabetes, which basically means for him, with all the research that he has done, there is no way you can reverse diabetes. You can only mask the symptoms using alcohol as you let the disease establish itself. And then when you suffer the consequences or when you suffer the complications of diabetes, well done. Simply die of diabetes because you got it on your own, right? That is the first thing that I realized. So we are not treating diabetes, we are managing diabetes. Number two, he said that alcohol is actually good for people who have diabetes because it lowers blood sugars. Now, if you've been here for long, you already understand that diabetes is not what you see in blood. Hyperglycemia is a symptom of diabetes. So, therefore, if we are using alcohol to lower hyperglycemia, that doesn't mean we are helping you treat diabetes, because diabetes is exactly the amount of sugar that is stored in your system, in the cells, the fat cells as fat, and the liver cells as glycogen, and the muscle cells as glycogen or even the same glucose. So if it's not being utilized by these tissues or by these cells, and then it's just stored there, and the more it gets there, the more it accumulates there, it creates like a dump site. It basically means a diabetic person already has a lot of sugar in the system, but is unable to utilize it. And once your stores are full, now the spillage that comes back in blood, and now that you're unable to send this glucose from blood to the cells because they are full, that means we have to confirm you with chronic hyperglycemia, and that is now diabetes. But hyperglycemia is not diabetes. So we are using alcohol to actually lower blood sugars, and this is how alcohol works in lowering blood sugars. Number one, alcohol is very messy to your pancreas. So this is controversial because you see, alcohol causes acute pancreatitis. So if it destroys your pancreas, you are unable to even produce insulin. Now that means you are unable to pump blood glucose into the cells. That causes hyperglycemia. Underline that, hyperglycemia, high blood sugars. But when the sugars are now getting, when the alcohol is getting to the liver, that's another process. In the liver, alcohol causes a stoppage of any other sources of energy. This is what I'm actually trying to say. For you to get glucose, one, you either eat carbohydrates and then you go through glycolysis and you get the glucose and you convert it to energy and the muscles start using that. So that is glycolysis. And number two, the body gets glucose. If you're not, let's say you're not eating carbohydrates, the body will get glucose from other sources which are non-carbohydrates, the proteins and the fats. So the body will turn to burning fats or turn to burning the or breaking down the protein to give you glucose. So you can get glucose from other sources that are not carbohydrates. That is what we call the gluconeogenesis. Okay. Now, alcohol blocks the liver's ability to carry out gluconeogenesis. So it blocks you from breaking down fat, from breaking down protein to get glucose. Now, this will automatically lead to low blood sugars, right? Let's say you're not eating a carbohydrate diet and then you take alcohol, because most of you eat that meat and then you take with alcohol. So when you do that, you are not taking in carbohydrates, so there's no glucose coming in. So the body has to turn to the fats to break them down and give you glucose. But alcohol blocks that process. And actually, alcohol blocks the oxidation of fatty acids in the liver. These fats are supposed to be oxidized to give you either glucose or energy. But alcohol blocks that pathway. So that's how you end up getting low blood glucose. But you see, those fat cells are actually glucose stored in form of fat. So which means alcohol makes sure that you will never burn the fat. So you'll always add the weight. Now diabetes is what is in the cells, not what is in blood. So if you are retaining the sugar in the cells, what do you expect? And that's the reason why he said managing diabetes. So you'll end up having the aftermath or the complications of diabetes, the loss of eyes, the kidney failure, the hypertension, the stroke, the heart disease. All these conditions will come as a result of you just maintaining that sugar in those cells. Because for you to recover from diabetes, you have to burn what you've stored in form of fats, in form of glycogen. You don't rely on lowering blood sugars, okay? If you're trying to treat diabetes, that's what drugs are doing. Medications simply lower blood sugars, but they pump these sugars from blood into these cells, into these fat cells that are already full. And that's how you start getting the complications of diabetes, even though you are on high doses of these drugs. So alcohol blocks that pathway of making glucose from these sources that are fats and that are protein. Therefore, you will remain diabetic. Again, I noted him saying that beer is the problem. You can take either wine or whiskey. So he classifies alcohol in form of wine, in form of whiskey, in form of scotch or beer. That is the wrong way of classifying alcohol. Alcohol is alcohol, regardless of where it's coming from. Beer, whiskey, and wine, those are just types of this same alcohol, but you cannot classify alcohol that way because alcohol is either ethanol or methanol, and beer, wine, whiskey, scotch, all of them contain ethanol, and the processes of breaking down ethanol in the liver are the same. Whether you take beer or whether you take whiskey, you will still break it down the same way because what you absorb is not beer. You are absorbing ethanol, and that ethanol will be taken to the liver, and the pathways for metabolism for ethanol will ensue. It will just be taken into the metabolic pathway of ethanol. Okay, so don't think that just because you're taking whiskey, and most of people who think that whiskey will help you burn fat, it's not. It's going to actually to make sure that you keep on growing fat. And then now, when you block the burning of fat, the fatty acid oxidation in the liver, what are you doing? You're going to accumulate fats in the liver, and that's how a fatty liver comes by. So alcohol will cause you a fatty liver, and that alcoholic fatty liver disease is the reason why you start getting systemic inflammation, is the reason why you get insulin resistance, so you will maintain diabetes. You'll actually be encouraging your system to keep on being diabetic. So you can imagine somebody who has studied all these things telling you one, moderate alcohol. How much is moderation? The body does not understand the language of moderation. It's always about compound interest. It's telling you take whiskey over beer. Yes, beer it has barley and is highly estrogenic, but when we are talking about alcohol, we are talking about ethanol. Whether it's beer or whiskey, it is the same. Okay, so therefore, if you have been diagnosed of diabetes, alcohol should be the last thing in your meals. Okay, sometimes when we start asking these questions, we are considered people who are, I don't know, because people want to defend bad habits. He's even recommending the best alcohol brands. Okay, so I start to ask myself, is he somebody who is on a pay slip or a payroll from the beer industries, from the alcohol industries? Start thinking. And thank you so much for tagging me in this post because it was necessary. And I hope somebody has learned from it.